Hey guys, welcome back to the Hilton True Wealth podcast. I'm Mark Miller, manager of the Hilton Family Office, and today I'm joined by Dr. Raj Kumar, chairman of the United Doctors of America, and we'll be discussing reform in the healthcare industry. So Dr. Raj, it's so great to have you. Good to see you, my friend.
Thank you very much. God bless you. Thank you for having me, Mark.
Absolutely. We've been great friends, and I wanted you to be on the podcast because I wanted people to kind of get to know you. First of all, you're a great guy with great integrity. I think you're doing big things in the world. But tell the folks that are listening today about your background, kind of your expertise, and some of the things that you're working on.
Okay. No, thank you, Mark. I appreciate it. You're too kind with your sentiments. So, when I get this kind of a question with regard to my background, I have a little daughter and she inspires me every day. I learn from her. I don't just press on her as a parent. And I think I'm defined by some of my hardships, tragedies that have made my life. And then I'll touch on kind of my successes. But been through some hard knocks. I've gone through rape, domestic violence, a marital affair. Lived in poverty housing on Section 8, went through a cancer scare. But then all of these things helped me pivot into a different world. I lived in an apartment complex, for example. I had a gang member on one side, a wife beater on another side. We got to know the cops on a first name basis. And it opened up a whole nother world to me as to what I need to do to plan my life. And so I'd always been a good student. And from there, fast forward, I went through medical school, law school, business school.
Where did you go to medical school?
Washington University.
Okay.
Yes.
And you're a lawyer too.
Well, I went through law school.
Okay.
I'm not an actual lawyer, but I have
Right.
enough knowledge and expertise that I use it where I need to.
Right.
And then, of course, I bring on others. And so I've taken my medical, legal, and business background, and I started a consulting firm where we're a group of 21 physicians. We're executive doctors. And we work with physicians. And then the other hat that I wear that I'm so excited about because of the kind of team I have, I serve as chairman of a large organization, medical consortium, we say, called United Doctors of America. It's a national movement in the United States centered around healthcare advocacy for the patient and provider. And we have a network of over 200 doctors and growing. So that's a little bit of a long story about my background, my life, Mark.
Right. So that's interesting. So tell me a little bit more about United Doctors of America, how that started,
Okay.
and maybe some of the key people that got together and what ultimately the ultimate goal is for them.
Got it. Okay. So basically, it started over tequila, limousines, and gala parties. All right. Okay. So the story begins about a year back in Washington, D.C. So, my career has been a little more non-traditional, perhaps, as an executive physician. So I've gotten a little bit of exposure in politics and business, not just healthcare with patients and the like. So I had the kind opportunity to be at the presidential inauguration in Washington, D.C. As an immigrant kid, that's very exciting to even be a part of such an affair.
Yeah.
I had special seats from a U.S. senator, so how could I say no? So I went there in that snowy terrain, was there for 7 days, spent $900 a night at Holiday Inn. and basically there were different meetings, there were different gatherings, there were different galas that were happening. And so there is some leadership that wanted to build a medical movement in a conservative capacity in the United States that was maybe doing something a little different or a little more than your typical medical association where you've got a bunch of just arrogant physicians running the show. So short story, one thing to another, they were looking for someone to kind of create, build, and lead this kind of organization. So through some of my relationships, I had been nominated through someone else, and then that's how United Doctors of America was born. I helped build the organization. I now serve as the chairman, and we advocate for the small guy to the big guy, from the patient to the nurse to the doctor to all kinds of healthcare reform and the like. And we've done a hell of a job. We have a very dynamic team. And so that's the story of how it began.
That's amazing.
There's your tequila, limousines, and
Yeah,
galas,
there we go. I like it. I like
Some
it.
stories I cannot reveal, but
Yes.
all right.
Well, just the ones we can.
Okay.
So, well, that's great because you talked about because that's one of the things that they're focused on, and you in other ways on reform. So, what does it mean when you talk about focusing on healthcare reform? Because I think to the average person listening, well, that could be a million areas. What is it? what is the primary focus on
okay.
reform?
So I'll preface it with this. So the mission, right? The passion behind the organization is that, one, we're a group of physicians and non-physicians, first of all. So the stakeholders in the game, we have pastors who are also healers. We have veterans on our board. We have entrepreneurs, technologists, and your physicians and your nurses, right? So doctors, we have to realize that we're not going to solve healthcare alone. Sometimes in our own arrogance, we can't even get out of our own way. So with that, our team has come up with a trifecta 3-part mission. We push for healthcare reform, healthcare transparency, and healthcare wellness. Reform, transparency, and wellness. And to answer your question, reform, what is reform? Reform is change, right? And hopefully change is meant for the better, progress. And so reform can go into a million directions, right? You can change how hospitals operate. You can change how legislation is done, how patients' medication is prescribed, what their insurance looks like. Some of these areas are very hard to change overnight. I get to work with U.S. senators and U.S. congressmen and congresswomen, and let me tell you, it's hard to get all of them together at the same time in the same place to watch the same damn movie.
Yes.
So how the hell
herding
are they gonna,
cats?
Right, herding cats.
Yeah.
Oh, that might be easier, actually. So how can you get all of these folks together and change legislation, right? Change the laws. I mean, if you want to change the speed limit in your town, good luck. That ain't going to be an easy process. So why is healthcare going to be? So what we've realized is, how do we sidestep that requirement of legislation to help better the patient's experience? And make no mistake, I'm also a patient. Even as an MD, I'm a patient too. I'm a human being. You're part of the dialogue. So reform in our eyes is, how do we touch the local to the national level? And I'll literally give you an example of what we're doing now to change some of those elements. So right now in America, we have about a shortage of 190,000 physicians. We have about 200,000 shortage of nurses, right? So the population on a level is stabilizing or growing, but our medical needs are greater than ever, right? Our chronic disease is at a $4.3 trillion rate. So that care is more needed, even if the population number doesn't rise. So we don't have enough servicers, right? The physicians, nurses, and medical staff. So we are working at a local level with mayors and sheriffs and county commissioners and local leaders to bring in nurses and doctors to a given area. I'll give you this example. One day, I got this knock at the door, and a mayor came to me and said, "Dr. Raj and team, I need some help because my voters, my constituents, are complaining they can't get into the doctor's office for 6 months, 1 year, even though they've been seeing that doctor for 10 years. They can't get their medications. They're unhappy with their insurance." Now think about it for a second. What does a mayor or a sheriff or a county commissioner have to do with healthcare? That's a federal matter, like immigration. You got to go to your congressman, your senator, or the president, or Medicare. So the fact that the localites, these constituents, which is also you and me, have banged on their door, it's a real issue. Because now those politicians, they have two problems. Those people won't vote for them if they don't solve the problem. And how the hell are they going to fundraise from that population too?
Right.
Enter our team, United Doctors of America. We are the problem solvers in healthcare.
Right.
So we've been working with such parties to bring in attractions for nurses and doctors. For example, a hospital will get them to hire more professionals. We'll have medical practices bring on associates like doctors and nurses. We'll help set up practices for even nurse practitioners and physicians. And what the counties and the cities can do is they can make these folks feel like kings and queens, really welcome them in, but two, give them benefits. It could be some, incentive on their salary, some provisions towards their home, some other services that they may not get if they were just a regular citizen in town. Attract them. Show them all the great schools, all the shopping, the airport, extra incentives on their salaries or bonuses. So it's subsidized. These medical associations or groups can get subsidized by local support. Because remember, Mark, I've been through health problems too. If you can't give health to your community, which at the end of the day is life, they're going to move out of town. And when those people move out of town, guess what? Your economic impact decreases.
The economics change completely. Yeah.
Property taxes go down. People are not buying at restaurants
and
malls.
healthcare is a big driver of our economy. You might know, but I can't remember the percentage of the economy, but it's huge.
It is.
So when I look at reform overall, the first thing I think is, oh, great, Dr. Raj, that you're doing this and you've got 200, 300 doctors. But is that just like not even a Band-Aid? I mean, barely even a Band-Aid are there other groups out there also working towards these reforms and actually trying to get positive things in? Because it's so huge. It's like, I look at the whole healthcare industry kind of like the government. It's like,
Correct.
hey, the train's left the station. It's going, 200 miles an hour. How do you slow it down? Even just slow it down to start thinking about then, quote, more reform.
Right. I agree with you.
Does that make sense what I'm saying?
It does. And I think that's why our team is unique. If you look at any other medical group or medical association, and many of them we work with, so it's not that we're in competition or in conflict with anyone. The boards are typically physicians only or close to it. And what they push after is the legislation change.
Yeah.
What I'm talking about, some of my own friends and colleagues, and some I may not even like to work with because they're a pain in the you-know-what. But the senators and the congressmen, they're fighting for all that legislative reform, tort reform as we call, and that's going to take years and decades. Whenever I'm at like some rally or a fundraiser or some political event, I'm that jerk to raise my hand and ask a question about healthcare because I know my stuff. But I've learned it because I failed, and I've learned it from wiser, better people than me. And I always ask the politician, whatever they're running for, how will you change healthcare? And I don't mean that you're going to increase the seats in medical school or in training facilities, because that's still going to take a decade. Those years for some student, right, at a 22-year-old kid to then come out and work as a physician or a nurse, they won't be there till maybe 10 years, 8 years. In the meantime, people are dying. The clock is ticking.
Yes, absolutely.
That is not a solution.
Right.
So when I hear that kind of answer, it tells me, sir, ma'am, you are uninformed. And that's how we've taken this answer and given an entrepreneurial spin. I don't need to have a kind senator or a kind congressman to make our solution. Our solution is between United Doctors of America and the local leaders, which include business leaders and the politicians. And it makes everybody happy. If you've got those services in a town, people won't leave. The other driving factor where people leave a community is there aren't enough jobs or the right kind of paying jobs, and housing affordability, right?
Yeah.
And healthcare. These are the three catalysts that either bring people into your community or push them to exit.
Absolutely.
And the local leaders know that because they know they're not going to change Medicare, Medicaid. They're not going to be sitting in Capitol Hill to fight these issues. So they got to figure it out on their own behind the scenes. And so that's how we've come in with solutions for our level of reform. And once we get this model a little more streamlined, I very much believe that we can transpose this into other states.
Yeah, it sounds so exciting. And for those listening or seeing us today on video today, why are we talking about this? Because True Wealth is about more than just, and I've mentioned this before, about just amassing a pile of money. It's about actually all areas of your life, and healthcare it affects everyone's lives. And if we have people like Raj that are putting these groups together that are going to come to the communities and bring our healthcare costs, I mean, it is absolutely imperative. Otherwise, healthcare costs are going to be 50% of our budget in the next, 10, 15, 20 years if we don't do something,
Correct.
right?
And where's that money going to come from?
Yeah.
They're going to have to cut down on roads. They're going to have to cut on, maybe food subsidies. Our way of life will be super challenged because we were going to have to shift all these monies to basically heal our population. And if I may say, call me a little crazy, when the health is not good, all the way down into the cafeterias of our little kids, right? All the way to our adult life, right? It takes away from the IQ of that productive citizen. That takes away from our workforce. That allows tech, robotics, and all that to come in and replace us. And then on top of that, when your IQ and your ability to work or the motivation to work changes, our military changes. So one can argue perhaps that this becomes an issue of national security. We won't have the kind of generation or personnel to manage those national defense matters. So I don't just say people, it's about your cholesterol or your obesity, even those can be life-threatening, but half the time we dismiss it. I remember the days in my own office, people would give an Oscar award-winning performance in the lobby for a $20 copay, but then they'd go down the street and spend $200 on, beer and wings, like what we do every Friday, So my point is, where are the priorities? Like you're fighting over a $20 copay to heal your cardiac health, but you're going to burn it on beer and wings without even a question, just like that. But the problem is, over time, it hits us.
Yeah.
We have a reduction in our fertility in the newest generation. We have 20% obesity in our children today. People have had some kind of health incident in 70% of our population right now. This is the United States of America.
Yeah.
So if these are our markers currently with a 4.3 annual spend in healthcare, why is it we believe we're going to be any better all of a sudden? So we could have great innovation. We could have great national defense. We could have, world-class economics. But if we ain't healthy, the robots haven't taken over, how is anything going to get done?
Right.
If you're not healthy, you can't go to work. If you're not healthy, you can't drive a car. If you're not healthy, you can't lead a nation.
Sure.
That's the beauty of what I'm talking about. From bus driver to billionaire, healthcare, wellness affects us all. We are the same damn DNA throughout all of our titles, mine included.
Yeah.
That's our common thread.
Yeah, and
we miss it too often.
When it comes down to personally, I didn't really truly understand this and truly internalize it until I was started to have some health problems, and then realized, oh my gosh, how important health is. Winston Churchill once said, "Youth is wasted on the young."
Yes.
So when we're young, we think we're going to live forever, and we're not going to have any health problems. Everything's going to be great.
I know.
I can't even imagine when I was my daughter's age, 24, and I distinctly remember I never thought I could ever die. I'm not going to die. That's never going to happen.
Correct.
And if it does, it's so far off, it doesn't make any difference. But the reality of it is years of it's so important to just continually take care of yourself. The good news is what I've learned too, and you're the doctor, and we'll get into some other segments to talk a little bit more about this, because I'm a little bit of a biohacker. I'm sure you're a big biohacker. What I've realized is that as you get it's not too late. Meaning people think, oh, I've already done all these things. I've destroyed my body. I can't possibly get back to good health.
Right.
When in reality, and we'll talk further in this, but my understanding is once you start getting in good health, then sometimes those cells start replacing themselves, and you can actually get to a place where you're in excellent health again and reverse some of those bad things maybe you did when you were younger and everything. So anyway, back to the reform.
I get that.
So what's your picture of the future of reform with what you're doing and maybe other people are doing out there? What is reform, if it's successful, if it really makes a dent, what is that going to look like?
Okay. I want to share one quick thought, if you don't mind, Mark.
Sure,
and then I can touch on that, what reform of the future might look like. You're talking about the youth, and I was that kid too. I was invincible. I would jump off of 3-story apartment buildings, swim with gators in the ponds. I was a rambunctious kid. Sorry, Mom.
We're fortunate you're still here.
I know. I turned out okay, allegedly. So what I was going to say is, if you look at our youth, though, today, too, I referenced autoimmune disease and obesity. So the youth of you and me, where we were playing out in the streets and the woods, and no one had to worry about us for 6-7 hours, and now we're all indoor on all of our tech devices. Unfortunately, our youth is getting hit in a different way than what we were hit with. So that invincibility factor is still there, I get it, but it is permeated into the health of our youth much sooner than maybe our generations and the ones that preceded us, which is unfortunate, because it's now an example of what could come with health, to now answer your question with reform. So our group, United Doctors of America, we've had the kind opportunity to sit down with the Tony Robbins organization, the Baldwin brothers, the actors, directors, also Hilton family and your office, and also with Damon John from Shark Tank, briefly. All of these folks are well-to-do, affluent individuals and groups that have great influence. The funny part is they're absolutely relevant to this conversation. In my conversations with such parties, they talk about biohacking, they talk about wellness, they talk about the same problems. And the common thread, right? I'm just maybe low on the totem pole as an MD. Some of these folks are billionaires. What do we have in common? The wellness, the health, because our DNA is the same. So if we can convince these great leaders, whether it's those legislators or our celebrities or influencers of the community about healthcare, and they're willing to expose that, I think we can help change the mindset of America, because these issues of healthcare if this were a global phenomenon in every single country across every piece of the ocean, I would say maybe there's less hope. But the United States of America, as an island for a moment, we're supposedly one of the most progressive countries in the world. We're supposedly the most technologically advanced, but we're still dealing with some basic problems. And healthcare is one of them. You don't see the same thing in Canada, in Europe, in India, other parts, the Far East. And it's telling us we're doing something wrong. Because they have the same DNA somewhere else. They're the same human beings. They were born the same way. They live the same way as we do. They die the same way. So what are we doing wrong, ladies and gentlemen? I heard recently with FIFA and the soccer games, the Finland team shipped their own food to play in the U.S. because they didn't trust the American food. Can you imagine? They're young, fit, intelligent human beings. They're invincible, aren't they? Why are they shipping their food? It's a quiet message to us. Like, oh my gosh, what is it we're taking in every day happily and willingly? Yeah. Right? We're drinking the Kool-Aid.
Sure.
So if we have
the
some
food
of these,
supply is just
ours
terrible.
is tainted, and I'm not going to pretend like I'm a saint. I eat this and drink this every day. My daughter does on a level as well. So if we have some of these great powers that be really endorse this kind of movement, even more than a reform, I think the change will come. Like, I'm going to give props and respect to Secretary Bobby Kennedy, who's sitting there as the Secretary of Health and Human Services, in our current U.S. administration. Look at his story. He was a drug addict. He's a trust fund baby, and he's an attorney, not a physician, a nurse, or healthcare worker of any sort. Right. But look at the impact he's made in healthcare. And even if somebody doesn't agree with him, he's created a platform from which we can all safely and welcomely speak on healthcare. That wasn't the case in COVID. And even now when I have doctors who argue against me, I said, shut up, get on the bandwagon. Because if the general population are now talking about, I'm not going to drink alcohol, or I'm going to stop smoking, or I'm going to watch out for food dyes or the soil, hey, they're making you look good. You have an easier job in the exam room now to help them get on behavioral changes, maybe medication, maybe procedures. And so they got a better bill of health. And if they have a better bill of health, you look much better as a doctor and nurse.
Sure.
Right?
Sure.
From the metrics and optics standpoint, but also for fulfillment. We go into healthcare because that fulfillment is what drives us, that purpose, that heart.
Sure.
So that's what I'm hoping to see with reform. A little celebration by our influencers, and 2, AI tech. I think that can help us if we wield that power properly with regard to the future of what healthcare is. Otherwise, if we don't do all of this, most empires have a 200 to 250 year shelf life. We're now at the 250th anniversary of our democratic gifted, these United States. If we don't catch this memo, if we don't see the writing on the wall, we are going to fall behind. We've had a mass exodus of talent and wealth already leave the United States. And that bleed, as I'm going to call it, is only going to continue if we don't get healthcare in order. I do see, and maybe I'm selfish or biased, I do see healthcare as a foundation for everything else. My mom is going through chemotherapy. I feel like a failure as a MD and a son, more than 1 year in treatment, and I've not figured out how to solve this. So I'm seeing healthcare from a whole new reviewing mindset. It's helping me to reprogram even my thinking. I grew up around Ayurvedic medicine, but my education is in pill popping commercialized medicine. So we need some hybrid of all of this to get done. So I'm saying,
is that what's called like integrative medicine?
Part of integrative, functional wellness. There's a lot of terms. Every decade there's a new label for the same drama, I can almost say. But I think we're in a little bit of a renewed perspective now between Kennedy, MAHA, Make America Healthy Again movement, and just some other powers that be. But we have to catch it, right? It's like go back now and someone just told you about Bitcoin or this open sandy land that they were going to make Vegas, or someone told you buy the first Nike stock, right? Like if you knew what you knew now, you would have jumped on any of those opportunities. And I don't mean it just from a wealth standpoint. I mean it from just like a purpose, changing humanity. Look at what Elon Musk. Yeah, he's there to make his money and have his fame. I'm not going to deny that. And I love what the guy's doing, but he's going to change the face of humanity.
Yeah.
Maybe he's seeing and his team
and
is seeing something
that needs to happen in the
seeing.
healthcare space too.
It does.
Yeah.
Because I think healthcare is going to change. We might solve certain diseases, but we're definitely going to make new ones.
Yes.
We are having autoimmune issues more than ever. So what is that? Autoimmune means the body is rejecting whatever you're doing. If your car is not starting, there's a problem. If the body is not starting, you got a problem. And eventually, if we don't respond to these issues, the car is dead.
Yes, absolutely.
And we're going to fall behind the rest of the world if we don't get this in order.
Yeah,
I very much believe in this.
And it sounds to me like you sound very positive that reform's going to happen. Obviously, it's going to take time, but
Creatively,
reform is going to happen.
Yes, creatively.
Yeah, absolutely.
Reform need not always be in Washington, D.C. or the typical
right. And I like that.
politician route.
I like that because I think people tend to look to government.
Correct.
And Washington to solve these big problems, which, by the way, politicians like that because then that gives them power and control. And generally, unfortunately, that turns into them just spending a lot of money and wasting half of it.
I agree.
But I love what you guys are doing with the United Doctors of America.
No, thank you. And even when I had a conversation with Bradley Hilton about this, no one's going to come to save you. We keep depending on government or some, knight in shining armor to show up. That's not how life works.
Yeah.
It's got to come from within in some capacity or another.
Absolutely. Great. Fantastic.
Yeah.
Well, a great conversation today. We're going to be having some more conversations with Dr. Raj. Dr. Raj, if someone wants to get in touch with you, what's the best way to get in touch?
Yes.
Something hit a vein with them today or something they want to chat with you
Thank you. Sure.
more.
We're always looking for volunteers, partners, board members. Our website, usauda.com. So USAUDA, which is United Doctors of America.com.
And
Email,
we'll put
my
that
cell
below
phone
for
number's
you
there.
too.
Yes.
So you bet.
Feel free to you have my cell, 305-989-0001. I'm not shy. I'm happy to talk with everybody.
That's fantastic.
This is my life's work and my life's purpose now. It's very personal.
All right, well, great. Well, we appreciate having you, and we'll look forward to having you on future shows.
Beautiful.
Thanks
Thank you,
so
Mark.
much.
Glad to
Thank
be here.
you.
Thank you for having me, Chief.
That brings us to the end of today's episode of Hilton True Wealth. If you want to learn more about topics relating to building your wealth, tax planning, cutting-edge tech, and family office services, we're here to help. Be sure to follow us wherever you get your podcasts so you'll never miss an episode, and give us a like or a review. And if you're curious to learn more about your wealth, tune in every Tuesday for new insights and special guests. If you found value in what you heard today, share it with someone who might benefit too. For more insights, resources, and to get a free copy of our book, Hilton Wealth, How to Invest Like an American Dynasty, visit us at hiltonwealth.com. Thanks for joining us. Until next time, keep learning, keep growing, and keep building your true wealth.